think everybody's here. Let's turn some of the sound down. Gets a little bit difficult to hear sometimes when it's too loud. There we go. It'll settle in the background. Wait just a couple more moments. Let's see if everybody's here. We have LaDon, Daryl, Nora, Raylene, Elma, only one missing is Claudia,
Victoria.
and Victoria. Victoria was not either. But we'll get started. So good morning, everyone. Join us again this week for our weekly update. I'm Troy, as most of you already know, and with the rest of the Health and Human Services team, we have Don Yazzie, Carolyn Martinez, Lenora Arietta, Raylene Martinez, and Thelma Gonzalez, all here to give you an update and answer any questions that you might have. The comment section is open for anyone who is going to use it to ask questions or make comments. And as always, if you aren't able to attend live, those are not here now, you can always provide comments in the comment section and questions later, even after the live session ends, and we can answer questions as they come. So again, it's July 21st, Thursday, and the time is 11:11 now. So let's talk about where we are with it's been a pretty a much improved last few days with regard to COVID cases. As you all know, we had quite a bit of a spike in the community, and now we only have 5 active cases. I should say only. I shouldn't say only. I should say we have 5 active cases. But what's good about that is that in the past 7 days, we've only had 5 new cases, and we've had no new cases since Monday. So that's a pretty significant change from what was going on before. We were averaging 4 or 5 cases a day there for a while, but now we're down to not having any cases for the past 3 days. Our total case count is now at 277 cases since the beginning of the pandemic. That's for just a little comparison between what we reported last week and what we're reporting today for the state of New Mexico. So yesterday in the state, there were 1,177 new cases. And you get the case count and the new case count previously, 1,170 new cases. Our death count for the state of New Mexico for yesterday was 22. 16 was the number that was last week. Our number of hospitalizations are up from last week, but the number of people that are on ventilators is down significantly. Looks like which less ventilated people means that there's a greater likelihood of less deaths as the days go by. We did have a day earlier in the week. We had 37 deaths in the state of New Mexico. Still kind of trying to figure out what the demographics were on that, trying to figure out what those numbers represent. But as the numbers get into the higher numbers of deaths, we always have to worry about where COVID and the coronavirus is taking us what our protections look like with our COVID vaccines and our past prior infections. So just wanted to make sure that that was clear for folks. Last week we talked about the variants of concern that are in the state of New Mexico, and we were looking at seeing how the BA5, the one that is talked about a lot on the media, is looking in the state. And as you can see, between the sequenced cases, last week of sequenced cases, the BA5 has increased percentage-wise pretty dramatically compared to BA4, and BA2 is definitely decreasing. But the BA5 subvariant of Omicron is now the dominant variant in the state of New Mexico. I'm going to talk a little bit about the new vaccine that was approved just 2 days ago. The Novavax, we talked about last week that it was pending approval, and now it has been officially approved as of July 19th. What does that vaccine look like? It is only available for 18 years older. Two-shot series similar to that of the Pfizer vaccine that's given 21 days apart. This vaccine has been available for people to get in other countries prior to today. I think one of the countries that uses it the most is the country of India. The population there is pretty high, so they had some pretty good data from when it was approved there last year about how effective this vaccine is against severe illness, severe disease, and death, as well as preventing asymptomatic infection. So I don't have that information here, but there is a lot of data out there on this vaccine, and we'll probably, if you have questions, you can actually contact us. I have it in my office, and I can give you the effectiveness of this vaccine. But what's good about this vaccine is that a lot of people were quite concerned about getting the mRNA vaccinations in the beginning because the feeling was that it was new and it was different, and there were concerns about it potentially modifying people's DNA and all these different concerns that were coming up. But this vaccine is actually more in line with how some of the older vaccines were created. We'll talk about that here on this next slide. This Novavax vaccine is available. I don't know if there are any available in the IHS service, Santa Fe service unit, or at any of the locations, but I do know that the federal government did purchase 3.5 million doses of this vaccine prior to its approval, and so it should be getting distributed sometime soon. So look out for that as another option for vaccination and coverage. Last I read was that it's about 90% effective against severe illness and hospitalization. Just real quick to cover the different, the 3 different types of vaccines there are now. Before there were just the mRNA and the viral vector vaccine, and just kind of give a history on these, just make sure you understand that they have been around for some time. The mRNA vaccine technology is not new. It's being used in humans to try to vaccinate against Zika and Ebola, and it was actually used in rabies vaccines for humans starting back in 2013. So mRNA technology is not new. It's just not talked about because it wasn't really a common thing that was used here in the United States. Zika and Ebola are not common illnesses here in this country. So commercially in the United States, it was not available or talked about because it wasn't used here a lot. But it has been used in the rabies vaccine as early as 2013. 13 subunit technology, which is what the Novavax vaccine vaccine, shingles vaccine, and hepatitis B vaccines. I've gotten these vaccines. I've gotten COVID-19 vaccine. So this is not new. It's not something to be concerned about, afraid of because it's something. Can I hear anything? And then the viral vector vaccine that's out there, similar to the Johnson vaccine. It's not used um, frequently. It's not a recommended vaccine. In fact, as recommended Pfizer and Moderna vaccines, J&J vaccines, because of the time that maintains its protection in comparison to Pfizer. It's the reason why the booster for Johnson and Johnson it needs to come after 2 months of being vaccinated, and Pfizer and Moderna 5 months after being vaccinated. But it's similar to another Ebola vaccine that's out there, and I know what the sound. Maybe I need to get closer because that better. I think I was leaning back because I was trying my best not to uh, speak too loud because I can hear the echo down the hall, and it sounds like I'm a lot louder than uh, I actually am. So, how about now? Testing. Lydia, can you hear me now?
Oh, that probably was because you're away from the mic.
I just wanted to make sure before I continue talking that it's better. I can probably turn up the output as well. Is that better? Okay. Sean says it's now noted. You can actually hear it now, I guess. Okay. So just to repeat, I was just talking about the three different types of vaccines because questions will come up with the new Novavax approval. I can hear that also is going in and out. The volume is going higher and lower.
I can hear it now.
What is that?
I'll sing while you're adjusting that.
Yes, you can sing. It probably makes it a lot better. I need to.
Yeah, I have both sounds muted.
It's cycling.
I just need-
Okay. Well, it's going in and out, so I'll just try to talk and make it um, as much understandable as I can. I need to close this door. Hold on just a second. Testing. Is that better? I hope it is. Um, so just did it again.
You think it's the sound, the music?
Let me turn. This is a new experience. This has never happened before. Okay. All right. So I can still hear it going in and out, but I'm just going to go ahead and finish. So I just wanted to make sure, as Novavax becomes more of a piece of the conversation around COVID vaccines, I just wanted to make sure that everyone understood the different types of vaccines and how, um, you know, there hasn't been a lot of conversation about the makeup of vaccines and the type of vaccines and whether the technology is new or not until COVID came around. But because it has become part of the conversation, I wanted to make sure that it is talked about. These vaccine types that are being used for the COVID vaccination efforts, they are not necessarily new technology, and I just wanted to point that out because this vaccine technology has been used in other vaccines in the past effectively, and has been the most common version of vaccines that we hear about are the flu vaccines, and Novavax is basically the same technology as the flu vaccine. So I see you there, Claudia. I'll let you in. It seems kind of strange that I didn't see you there. My apologies. Okay, now Claudia is here. Okay, so I just wanted to make sure that this conversation has been started. Um, and it kind of gets to the confusion that might come out of this as time goes on. Because when the concept of mRNA vaccines came out, the it just turned into this big, huge political storm. I almost said something I shouldn't say. Um, a crazy storm that I don't. It was kind of difficult to get people to understand that these vaccines are safe because the concern was it was developed too quickly. This is new technology, um, but in reality, the mRNA technology has been around since the 1990s. It's not like it's brand new. It's just that it's just recently been talked about because it is now in the American conversation as opposed to the African conversation, which is where a lot of the Zika and Ebola um, usage of mRNA came from. So the protein subunit conversation might start the same exact firestorm because people don't hear about that. And what protein subunit is it takes these little pieces of protein and synthesizes the spike protein on the COVID virus, and it uses that protein to deliver um, a message to basically to the human body to create antibodies to start fighting against the the COVID virus. So it's similar to the other ones like shingles, like we talked about before, and hepatitis B, and the flu vaccines, the ones that we've been getting for quite some time. I know I've been getting a hepatitis B vaccine since I don't know, probably for 25 years because of the work I've been doing. So um, and then the viral vector vaccine is it's something that there is an active Ebola vaccine that's been used in Africa, consistently has been used in Africa for quite some time as well because it is um, pretty effective. So when the Johnson and Johnson vaccine came out, it was a similar conversation about what is a viral vector? Is this new technology? But in reality, it's been used around the world for quite some time. So hopefully that stops questions, or at least gives people a reason to do their own research around this technology to make sure that there's not a lot of misinformation that comes out around this, because Novavax approval is probably going to start something else, because the way it's been advertised is that maybe it's going to increase the possibility of individuals who have refused to get vaccinated because of mRNA. They might start using this one because it's a commonly used technology. But of course, we know how political COVID has gotten. So it may start another conversation and have some more misinformation out there. So I wanted to get ahead of that before um, it happens, at least here in the community, so that people are aware that this is something similar to what we get pretty much every year with a flu shot. So it's not dangerous, it's not new, and it is effective. So keep your ears out for when it comes available. at either IHS or your primary care provider at Smith's or Walmart, Walgreens, CVS. They'll all start having it soon. Like I said, the United States government purchased 3.2 million doses of this, so it should start getting distributed since it was now approved. So keep an eye out. If you have any questions, you can contact us over here at HHS. Also, the other thing that keeps coming up is questions about who gets a booster and how to get a booster. But there is a website that you can go to that can basically, if you type in your status, who you are, what your demographics are, it can tell you when you're eligible for your booster and um, when and which booster you should get. And I should note before I finish saying this that Novavax has not been approved as a booster dose as of yet. It is basically used as a primary series, either basically your first and second dose. So it's not something that you can get as a booster dose if you've gotten the Pfizer or Moderna vaccine. However, I want to make sure I included this because some folks, adding it right now, some folks are kind of confused about when they're eligible and which vaccine booster they should get. And this link to the CDC provides you with that guidance. Um, so, because it does get confusing, the more boosters we get, the more vaccines that are approved, the more age ranges that are approved, it's hard to keep up with it. And trying to put a visual here on the screen and talk about all of these different vaccines and boosters is actually kind of confusing for people, even if we try to explain it. So I just wanted to make sure that you had a resource because I think the majority of the folks who are looking at vaccines are more likely looking at boosters and not necessarily primary series of vaccines. So um, click on that link, put in your information, and you'll get your answer about how to get boosted and when. Another conversation that's come up, um, lots of confusion and even um, people saying that it's not and it's not a good thing that this is happening, but uh, the home test kits that were distributed by the United States government, the iHealth COVID-19 home tests, the HHS has distributed some of them in the past, and there were a lot of calls coming in asking about the expiration dates because, as you can see on the screen, June 27th and July 10th were the two most recent expiration dates that were listed on these home test kits. However, there was back last year, the manufacturer for the iHealth COVID tests requested permission from the federal government to extend the shelf life of these test kits. And the reason why they are extending them is that as time goes by and more research and testing is taking place, information is coming out about the effectiveness of these test kits. Now, one of the things that did come up about this, and the reason why the extension happens, is that these tests are just like some of the vaccines were issued under emergency use authorization. So the emergency use authorization only lasts for a certain period of time. So as the emergency use authorization continues, they're going to continue testing the effectiveness of these kits to make sure that they are still functioning as they're supposed to and detecting the virus particles the way that they're supposed to. So there's been two extensions, both of them 6 months in length since December of 2021. So as you look at the expiration date that's on there now, the old expiration date, the approval happened December 2021. The expiration date was right around June, July of 2022. That's about 6 months since the approval. So that was the first extension. Then, when they realized that these test kits are really effective, they are continuing to quality check the kits, including the solution that's inside of it, and the actual receivers that you're getting the test results on. They're realizing that they're still effective as long as you keep them at the right temperature. If you keep them in a position where they're too cold, they will not work or potentially won't work. If you have them in a condition where it's too hot, they may not work. So leaving them in your car or some things like that can actually make these test kits not effective. Which is, you can see in the bottom of that little picture on the screen, it has temperatures on there. It needs to be within the temperature range that's on there in order for them to remain effective. So the extension that just happened, that they just released recently, extended these test kits into another 6 months, which, as you can see, the one that was originally expired on June 27th, is now expires on December 27th. And the one that expired in July of 2022 now expires in January of 2023. So that's both of those are exactly 6 months extensions based on the emergency use authorization. They are still picking up virus particles. I think that one of the concerns that we have is that people are testing at times when they're not supposed to be testing. And so they think that these test kits are not effective. But what happens is, what we've been noticing is that community members are, as soon as they get exposed to someone, within 1 to 2 days after being exposed, they're taking a test and they're testing negative. And then a few days later, they develop symptoms, and then they get upset because they test again in 2 to 3 days. And from that same exposure, now they're testing positive. So they're saying that the test kits are not accurate, when in reality, even the test uh, instructions say, and the recommendation from the every everybody, all the medical community, is that you don't test until 5 days after your exposure. 5 days after your exposure is more likely going to be within that incubation period where the virus particles start to show in your nose. So if you're testing before day 5 of your initial exposure and you're getting a negative test, don't trust that test result, because you're not falling in line with the recommendation. The recommendation is you test 5 days or more after your initial exposure, unless you have symptoms. If you have symptoms, COVID like symptoms, then you can test, because maybe in your body, the virus replicated fast enough to start showing enough virus in your nostril to find um, virus to give you an adequate and accurate test result. So the expiration should not be any way confused with that, because people will start questioning if the test kits are effective because they are not picking up virus. But in reality, people are not testing in time, that in the time frame that they're supposed to test, and then they're getting negative tests and not necessarily understanding that it's not the test kit. It is your we say it's operator error, right? The operator is not following in line with the recommendations or the instructions. So, also, I wanted to mention, a lot of people are um, coming to us after testing positive, or after just having some concerns about whether they have COVID or not, because they have what they thought were symptoms of allergies. And, you know, every single year they put out these charts that say, is it allergies? Is it a cold? Or is it a flu? And they put the symptoms right next to each other on these charts. And they are giving you examples of how the symptoms cross over between the different illnesses, the different viral infections. And um, the reason why they do that is because people many times assume that what they think are allergies are just allergies. And in fact, it's either a cold like an adenovirus or one of the other coronaviruses that's not COVID, which is basically one of the common cold viruses, or it's the flu. And instead of going to a doctor and getting tested for the flu or strep or whatever that it might end up being, they just assume it's allergies. That's happening now with COVID. People are not understanding that symptoms of COVID also mimic symptoms of allergies. In fact, most people who are contracting the COVID virus are only exhibiting symptoms similar to that of a common cold or um, allergies, which is the reason why the recommendation is, especially since COVID is still part of the conversation, is that if you feel like you have allergies or any symptoms that might be related to COVID like symptoms, quote unquote, you should test. The tests are free. You're not going to, um, you know, uh, waste a test just because you are testing and because you're symptomatic. It's better to know if you have symptoms of COVID than to assume that it's allergies and you're walking around and you're what they call shedding virus um, in the presence of other people, and then they're contracting the COVID virus because your response to COVID might just be that simple allergy like symptoms, cold like symptoms, but the person who contracts it from you they may not have the similar immune response and they could get sicker. So, what is the recommendation? Let's review that. 5 days after exposure to a person that is known to have tested positive for COVID 19. If you test at day 5 and you are negative, you should test in 2 more days because, like we talked about earlier, it's at least 5 days after exposure. Some people's bodies don't produce enough viral content until um, day 7. So, you test. That's why the kits come with two kits inside of it, two test kits inside of the one box. You take the one test at day 5, and then 2 days later, you take the other test to make sure that you are not positive. And if you're negative after the second test and you don't develop symptoms, you should pretty much assume that you're probably not going to be positive. You can't say for certain because some people's bodies fight off the virus for a long time before it actually starts to show. That's the reason why they've always put that 14-day window out since the beginning of COVID, is that some people will develop symptoms at day 2, some will develop symptoms at day 10. And so just making sure that you test in the accurate and most effective time frames, 5 days after exposure, and then again 2 days later. If you test positive, it's a similar concept, right? You test positive. We have a test out process within the executive order. It is now at day 7. So if you get to day 7 and you're testing positive at day 7, you should wait another 2 days before you test again. Because otherwise, you're going to use a test and more than likely still test positive on day 8 when you should be testing the second time on day 9. The average amount of time that people in the community are testing positive for this variant of COVID is somewhere between 6 days and 10 days since their positive test or since their symptoms originally showed. So, um, the reason why the executive order has extended the isolation period from 10 days to 12 days And the test out period from 5 days to 7 days is based on how long this virus is staying in in your system. Based on also what we are seeing here at HHS when we're testing people. We used to get people in the beginning that were testing out at day 3. They come in here and they test 3 days after they tested positive originally with the BA2 subvariant, and they were testing out between 3 and 5 days. So we maintained a 5 day test out. Well, now the average is somewhere around 8 days. People are coming in and they're trying to test out, and somewhere between 6 and 10 days is when people are actually finally testing negative and their symptoms are starting to subside. So the BA5 variant, like we talked about earlier, is a more contagious variant. They're saying it is the most contagious of all subvariants since the beginning of the pandemic. Not saying it's more dangerous, but it is apparently a lot more contagious. So trying to maintain some level of protection in the community by providing an extra couple of days to allow for the virus to clear your system, so that we can test you or you can test yourself at day 7, and that way you're protecting your family and your friends and the community a little bit better. So um, I incorporated the new version of the executive order in that conversation because it's relevant. So if you have any questions or comments, just go ahead and put them in the comment section. We're going to keep going. So, as Santiago Day conversations are going forward, and the conversations about what we should do if there's going to be gatherings or activities, I wanted to include the most common identified COVID safe practices. Every single time the blast goes out, it always says practice, engage in COVID safe practices. I just want to remind everybody what that is. So, the best protection, of course, is getting vaccinated. That will help you to not develop serious illness or end up in the hospital. And if you have gotten your first 2 shots and it's been more than 5 months and you're eligible for a booster, you should have gotten your booster by now. It's already to the point where you can actually get a second booster if you meet certain criteria, if you're over the age of 50, or if you have immunocompromising conditions. So, a booster shot is something that will protect you a little bit better. I can tell you that a lot of the folks that have tested positive recently were vaccinated with the first 2 shots, but they hadn't gotten their boosters. So you can tell the difference between those individuals in many cases by the severity of their symptoms. Some had very mild symptoms, some were asymptomatic, but others had pretty severe cold and flu like symptoms, and had some challenges potentially with oxygen concentration. So um, that's when COVID starts to get dangerous, is when your oxygen levels are affected. So that's one of the reasons why getting boosted and keeping the symptoms from getting um, too bad. If you do get a what they call breakthrough infection, which BA5 is is very well known for right now. There's a lot of reinfection happening with the new subvariant, and that means if you've had COVID in the past, the protection that you thought you were supposed to have before, they're telling you between 90 and 120 days. For your standard population, that's those individuals over the age of 25, the protection that they have against reinfection is pretty high if you've had COVID in the past. But this new BA5 is actually finding its way around your different types of protection, whether it's vaccination or prior infection. There was a new study that was released just this week, though, that talked about your young people who they actually are showing to have protection against COVID for up to a year after their last infection. But that's for your young people, your kids, and your teenagers and things like that. Um, but they're also less likely to get COVID. So that's a whole nother conversation. So wash your hands often and avoid touching your eyes, nose, and mouth. Um, when people are coughing and sneezing and not covering up their face, like the next um, bullet point says, and that virus is on hard surfaces. We have been heard a lot about the um, the length of time that the virus stays alive on hard surfaces like plastic and tables and things that are not porous. If you touch that with your hand and rub it in your eyes and on your nose and put your hands in your mouth, those are the most common um, methods that COVID enters the human body. You're actually increasing the risk of contracting the virus. So wash your hands as often as you can. That's why that hand hygiene is always a big conversation. Cover your coughs and your sneezes. Stay home if you're sick, and avoid close contact with other people who are sick. A lot of people, this goes back to the whole allergy or cold or nasal congestion conversations. They think it's just the smoke outside or the rain or whatever they feel like it is. If you're sick, you probably should test. If you're feeling really sick, you probably should stay home. Practice social distancing by putting at least 6 feet distance between yourself and other people. Wear a mask. In the state of New Mexico, as of course, we don't necessarily follow the CDC or the state's guidelines, but the recommendation is that children ages 2 years and older should wear um, masks when they're in indoor enclosed spaces. We always talk about how the viral concentration in an enclosed space without ventilation increases. So wearing a mask inside of an enclosed area is a good idea because it helps to prevent the transfer of virus between two different people. And this is, of course, regardless of vaccination status. Clean and disinfect frequently touched surfaces. This goes back to the whole conversation that we had about washing your hands and avoiding touching your eyes and nose. These frequently touched areas. I don't know if any of you have seen the videos or were in high school biology or some of these other places when they show the light switches and the doorknobs and the very commonly touched places and the amount of virus and pathogens and all kinds of stuff that live on those surfaces because we're consistently touching them over and over and over is actually pretty astounding. COVID is no different. If you're consistently touching the doorknobs and the light switches and the knobs that you turn on the water in the bathroom and the toilet, the plunger to flush the toilet, all these areas are very frequently touched areas, and they should be wiped down and cleaned as frequently as possible. That way, you can reduce the amount of virus, COVID-19 virus, as well as any other virus that may be living on there. You can have an opportunity to reduce those viruses and pathogens and bacterias, and keeping your family and yourself healthy overall, not just um, with connection to COVID-19. So as far as COVID is concerned, I don't have. That's it. If you don't have any, if anybody has anything else to add or has any questions, you can throw them out there. Otherwise, we can go to a quick update from the department and the rest of the programs.
Nothing COVID related for me.
You're supposed to sing your song next, though, right?
Yep, I'm gonna sing. I'm gonna I'm gonna sing us into the next.
Into the next section. All right. COVID is always first because it is the primary conversation that we have all the time. So we wanted to get that program out of the way. And Victoria's not on, so we don't have a healthy kids, healthy communities conversation. But we can ask Claudia and Thelma to provide a CHR update.
I don't have anything on CHR. We're still going out into the homes to make home visits. We're doing our screenings. We're doing walking on Tuesdays and Thursdays, which will eventually be in the gym because at 8:15, it's already very hot in the morning. So I just want to add the seniors farmers market nutrition program. Some of the checks were sent to me last week, so they were issued. So they're slowly sending them out. My understanding was that I thought they were going to be going to the individuals' um, addresses, but apparently they're sending them to me. So to get signatures for verification of receiving their checks. And then also just to add to that, the cards that they're sending out are something like trying to think of the name, EPT cards. So those cards are going to be used next year again. So don't discard the cards that are going to be sent to you or that I'll be delivering to you. Those will be a permanent card that you'll use every year. Other than that, that's all I have. Thank you.
Thank you, Claudia. Double, you have anything?
Thelma went to pick up the items at Buffalo Thunder.
Oh, okay. Well, you can give your SDPI update then.
Good morning, everyone. It's almost lunchtime. I'm sure we're all hungry. But I just wanted to give an update. As far as the Santiago Day run, it looks like the run will only be open to community members. So if you could please look out for an update or information on the Sinai page or the Health and Human Services page. And once that information is clearer, if you could please, share that with anybody that you know was thinking about participating. We should have that cleared and set with whether or not other community members can attend or individuals from other Pueblos can attend. That should be finalized by tomorrow. So please be on the lookout for that. With that being said, I hope to see many people from the community participate. This more so will be our first large event since the Pueblo has opened. So the run will begin at 6:30, and then the walk will begin soon after. Like Claudia said, it is hot around 8 o'clock, and so I understand it is early, but I hope to see many people from the community participate. Also want to point or share that the diabetes program is having a shoe and acupuncture event on August 9th. It'll be from 10 to 12:30. So please mark your calendar. Individuals that have been diagnosed with diabetes will receive a free pair of shoes. We are partnering with Happy Feet of Albuquerque to make this possible. So please take advantage. This will be a one-time event, and again, this will be for individuals that are diagnosed with diabetes. You must be a tribal member, and you must be living here in the community as well. If you would like to participate in the acupuncture part only, that's also possible. If you could please give me a call to schedule that appointment, we would greatly appreciate it. And you can call me at 505-660-8927. And again, that'll be on August 9th. And then again, just talking about gym memberships, they are available to tribal members and those living here in the community. Memberships are open to Los Alamos and Espanola Anytime Fitness locations, as well as the Milwaukee Pueblo Wellness Center. A fitness assessment is required, and so if you do need to schedule an appointment for that, please contact myself or contact Troy. You can also contact Miss Victoria Martinez, and we will get that set up for you. The assessment takes about 20 to 30 minutes, and you should dress comfortably. So I hope many community members take advantage of that. It is, a benefit to you, and so please sign up. And that is all I have right now.
Thank you, Raylene. Lenora, you have anything from ICWA?
Hi. I just wanted to go ahead and let everyone know just what just a few things that a family advocate does. And also to apologize that I'm so short and you guys can only just see my forehead. So a family advocate helps families connect with resources such as WIC, Circle of Life, or other behavior health, Medicare, Medicaid, educational, and those are just to name a few. We assist caregivers in filling out applications and going through the process to obtain services, provide advocacy and support to family members by promoting health, wellness, and optimal psychosocial functioning for families and caregivers. A family advocate provides a listening ear and is a bridge support person. ICWA Family Advocate supports caregivers to develop skills to advocate for their children and families. Again, my office number is 455-4164, and the cell number is 699-0164.
All right, and last but not least, Daryl, and you have anything from the COVID-19 community health worker side of the program?
You're muted.
There you are.
Hi. I just wanted to let you know about the vaccines for children ages 6 months to 5 years old. They had started giving them back on June 30th at the Santa Fe Indian Health Center, and they continue to do that every Thursday in the afternoon. You would have to call the number 505-946-9203 to schedule an appointment. So if you know any kids in that age group that are want to get the vaccine, you could spread the word.
What's that number again?
It is 505-946-9203.
No. Okay. So I think that's it. We don't have anything else going on. If there are no more questions, Raylene, did you want to answer Jeannie's question?
Good morning, Jean. The gym memberships are for tribal members only at this time. Hopefully in the near future, we can open it up to community members, but for now, the gym memberships are strictly for tribal members only.
Okay. All right. So that is it. It's 12:03. We're 3 minutes over. It's lunchtime. I'd like to thank everyone who not decided, but who joined us live. And for those who are going to watch this recording later on, we are still working to do as much as possible to assist the community to recover from this pandemic and the closure. The Pueblo has only been open for 2.5 months. And so we are trying our best to keep that the way it's supposed to be, open, and activities continuing. There are, of course, going to always be concerns as long as COVID is around and we're having major spikes in cases either in the state or in the Pueblo about large gatherings and crowds. The questions that are being asked are why there are going to be restrictions to any kind of activities um, with, say, for example, Santiago Day celebrations and the run, and that's pretty much the concern is that when you have large events, large gatherings of people tend to be possible, and so there's always concerns about whether large crowds, large gatherings can contribute to another spike in cases. So the governor, the executive order actually states that the gathering size and the lifted restrictions from the executive order can be adjusted or modified based on the current COVID status in the community, which means the numbers that are in the community. So I just wanted to make sure that, just in case questions about that come up, that is the reason why we are tasked with, discussing with the governor um, what concerns there might be around COVID and large gatherings and potential spread of virus, and potentially coming up with guidelines that might help to reduce that risk. The risk is never going to be at zero unless we just all stay in our homes, and that's not going to happen. So we have to do what we can to keep the risks low, reduce it as much as possible. And so by tomorrow, sometime, we should have some sort of an answer or idea of what that's going to look like, and the community will be notified as soon as we know. So again, thank you all. Appreciate your time. Thank you, LaDon, Darylyn, Lenora, Raylene, Claudia, and recently Thelma, before she signed off, for joining us and helping to provide this notification and update to the community. And we will see you all next week. Same time, same day, same method, Facebook and YouTube. So talk with you all later.